Hello everyone and welcome back to my channel. Today we're talking about cholesterol management, specifically alternatives to statins. If you've been prescribed a statin to lower your cholesterol but are concerned about side effects or simply want to explore other options, this video is for you. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Statins are some of the most widely prescribed medications in the world. They are highly effective at lowering LDL cholesterol, often called the bad cholesterol, and reducing the risk of heart disease and stroke. However, not everyone tolerates statins well. Some people experience muscle pain, weakness, digestive issues, or even more serious side effects like liver abnormalities or an increased risk of diabetes. Others may prefer a more natural approach to managing their cholesterol. The good news is that there are several alternatives to statins, and many of them have strong scientific backing. In this video, we'll explore different options, including other medications, lifestyle changes, and natural therapies, and we'll consider the evidence behind them so you can make an informed decision about your health. One medication that can be used as an alternative to statins is called ezetimibe. Ezetimibe works differently from statins by blocking the absorption of cholesterol in the small intestine rather than interfering with cholesterol production in the liver. Studies show that ezetimibe can lower LDL cholesterol by about 18 to 25%. While this reduction isn't as dramatic as with statins, ezetimibe can be a good option for people who are statin intolerant or who need additional cholesterol lowering effects when used in combination with other treatments. Another newer class of cholesterol-lowering medications is PCSK9 inhibitors such as alirocumab and evolocumab. These are injectable drugs that work by increasing the liver's ability to remove LDL cholesterol from the bloodstream. Clinical trials have shown that PCSK9 inhibitors can lower LDL cholesterol by 50 to 60%, making them one of the most powerful cholesterol-lowering medications available. They are particularly beneficial for people with genetic conditions like familial hypercholesterolemia or those who have very high cardiovascular risk. However, these medications tend to be expensive and access may be limited depending on insurance coverage. Bile acid sequestrants such as cholestyramine, cholesevelam, and cholestyramine are another category of non-statin cholesterol-lowering drugs. These medications bind to bile acids in the intestine, preventing their reabsorption and forcing the liver to use more cholesterol to produce new bile acids. This process leads to a reduction in LDL cholesterol, typically by 15 to 30%. While effective, bile acid sequestrants can cause gastrointestinal side effects like bloating, constipation, and nausea, making them less desirable for some patients. Another medication that has gained attention is bempedoic acid, which works similarly to statins by inhibiting cholesterol production in the liver, but without affecting muscle cells. This means that it may be a better option for people who experience muscle pain with statins. Clinical trials have shown that bempedoic acid can lower LDL cholesterol by 15 to 25%, and it has been approved for use in patients who cannot tolerate statins. For those looking to manage cholesterol without medication, lifestyle changes are one of the most effective strategies. Diet plays a major role in cholesterol levels, and adopting a heart-healthy eating pattern can significantly lower LDL cholesterol and improve overall cardiovascular health. The Mediterranean diet, which emphasizes fruits, vegetables, whole grains, healthy fats, and lean proteins, has been extensively studied and is associated with a reduced risk of heart disease. Research has shown that people following a Mediterranean diet can lower their LDL cholesterol by about 10 to 15% while increasing HDL, or good cholesterol. Another dietary approach with strong evidence is increasing soluble fiber intake. Soluble fiber binds to cholesterol in the digestive system, preventing its absorption and helping to lower LDL levels. Foods high in soluble fiber include oats, barley, beans, lentils, apples, and flax seeds. Studies suggest that consuming at least 5 to 10 grams of soluble fiber per day can lower LDL cholesterol by 5 to 10%. Plant sterols and stanols are another natural option. These compounds are found in small amounts in fruits, vegetables, nuts, and seeds, and they work by blocking cholesterol absorption in the intestine. Many food products such as fortified margarines, orange juice, and yogurt drinks are enriched with plant sterols. Clinical studies have demonstrated that consuming 2 grams of plant sterols daily can reduce LDL cholesterol by about 10%. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, have also been shown to improve cholesterol levels. While they don't significantly lower LDL cholesterol, they help reduce triglycerides and inflammation, both of which contribute to heart disease risk. Fish oil supplements can also be beneficial, particularly for people with high triglycerides, though whole food sources are generally preferred. Regular physical activity is another powerful tool for improving cholesterol levels. Exercise helps raise HDL cholesterol and can lower LDL cholesterol and triglycerides. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic exercise per week, such as brisk walking, swimming, or cycling. Studies show that regular exercise can reduce LDL cholesterol by 5 to 10%, and when combined with dietary changes, the effects are even more pronounced. Weight management is closely linked to cholesterol levels. Losing even a small amount of weight, around 5 to 10% of body weight, can lead to significant improvements in LDL cholesterol, triglycerides, and overall heart health. This is particularly important for individuals with metabolic syndrome, a condition that includes high cholesterol, high blood pressure, insulin resistance, and excess abdominal fat. Reducing saturated and trans fats in the diet is another key strategy. While dietary cholesterol itself has less of an impact than once thought, saturated fats found in red meat, full-fat dairy, and fried foods can raise LDL cholesterol. Replacing these with healthier fats from sources like olive oil, avocados, and nuts can improve cholesterol levels and overall heart health. Trans fats, which are found in some processed foods and baked goods, should be avoided entirely, as they not only raise LDL cholesterol but also lower HDL cholesterol. I also want to talk about carbohydrate intake. We are learning more and more about the impact excess carbohydrates have on atherogenic or plaque-causing cholesterol. Carbohydrates are broken down into glucose during digestion, raising your blood sugar, which leads to cholesterol creation in the liver for fat storage, causing increased cholesterol levels. I recommend to all my patients reducing excess refined carbohydrates. For those interested in natural supplements, red yeast rice has gained popularity as a cholesterol-lowering alternative. Red yeast rice contains monocolin K, which is chemically identical to the active ingredient lovastatin, a prescription statin. Studies have shown that red yeast rice can lower LDL cholesterol by 20 to 30%. However, because it functions similarly to statins, it can also have similar side effects, including muscle pain and liver issues. Additionally, the quality and potency of red yeast rice supplements can vary significantly between brands, making it important to choose a reputable product. Niacin, or vitamin B3, has also been used to manage cholesterol levels. Niacin can increase HDL cholesterol and lower triglycerides, but its effects on LDL cholesterol are less pronounced. While it was once commonly prescribed, recent studies have raised concerns about its long-term benefits and potential side effects, such as flushing, liver damage, and increased blood sugar levels. Because of these risks, niacin is generally not recommended as a first-line treatment. Another promising area of research is probiotics and gut health. Some studies suggest that certain probiotic strains, such as lactobacillus and bifidobacterium, may help lower cholesterol by influencing how the body absorbs and processes fats. While more research is needed, maintaining a healthy gut microbiome through fermented foods and fiber-rich diets may have additional cardiovascular benefits. I want to bring up one important point. LDL reduction does not necessarily result in decreased cardiovascular risk. It is important to not only treat a number, but to utilize treatments that have been shown to reduce the risk of heart attack and stroke. Ezetimibe, PCSK9 inhibitors, bempedoic acid, and the Mediterranean diet fits this bill. If statins are not for you, then I would highly consider one of these treatments. In summary, while statins are the gold standard for lowering cholesterol, they are not the only option. Alternative medications, dietary changes, physical activity, and natural therapies all play a role in cholesterol management. The best approach depends on an individual's specific health profile, risk factors, and personal preferences. If you're considering alternatives to statins, it's important to discuss these options with your doctor to find the safest and most effective strategy for you. If you found this video helpful, please give it a thumbs up and consider subscribing for more health-related content. Let me know in the comments what approaches you've tried to manage your own cholesterol. Thank you for watching. As always, take care of yourself and make the most of your day.